Good morning, everyone. Can everybody hear me okay? Thanks for the note, Chrissy. So good morning, everyone. Thank you for joining us today. My name is Sandy Frentz, and I am the co-chair of the American Heart Association South Dakota Cabinet for Medicaid Expansion. So earlier this year, I retired from the city of Sioux Falls as public health manager after almost 37 years of working within the health department. When I worked in the health department, my work really centered around coordinating and managing the operations of clinical and environmental programs for the city of Sioux Falls, as well as coordinating public health programs with a number of community partners, including EMS, fire and ambulance services, which is why as we get together here today to make this announcement, I am so very excited because these are really agencies that are very near and dear to my heart, as is the project we're working with. South Dakota's first responders are joining the campaign to expand Medicaid in the state of South Dakota with their support of Constitutional Amendment D. The South Dakota EMS Association and the South Dakota Firefighters Association, who represent first responders in the state of South Dakota, have endorsed Medicaid expansion efforts in our state to strengthen rural healthcare and rural economies. Medicaid expansion will make South Dakotans healthier and our economy stronger. It delivers affordable healthcare options to people working hard at jobs that don't offer insurance and brings our tax dollars back home to create jobs, grow our economy, and strengthen rural hospitals and healthcare systems, as well as first responder services. Voters have the opportunity to support Medicaid expansion on the ballot this November with a yes vote on Constitutional Amendment D. Amendment D will require that the state of South Dakota provide Medicaid services to any person over the age of 18 and under the age of 65 that earns less than $18,000 a year. And then for families, for example, a family of four earning less than $37,000 a year. Federal funding will pay for 90% of the expansion costs, with the state of South Dakota being responsible for the remaining 10%. According to the South Dakota Legislative Research Council, expanding Medicaid means South Dakota will save more than $63 million in general funds in the first 2 years alone as a result of additional funding through ARPA programs. Medicaid expansion would also return more than 1.3 billion tax dollars to South Dakota from Washington, D.C. over a 5-year period. Today, I am joined by representatives of the South Dakota EMS Association, as well as the South Dakota Firefighters Association. And I would now like to welcome Amy Marsh so that she can provide some comments from the EMS Association.
Thank you, Sandy, and good morning. My name is Amy Marsh, and I have been in emergency services for over 30 years in the state of South Dakota, serving as a volunteer. I'm happy to represent the South Dakota EMS Association as their vice president and to announce our support of the Amendment D and Medicaid expansion. South Dakotans value hard work in helping our neighbors, but right now there are hardworking people across our communities who are slipping through the cracks. South Dakotans who can't access healthcare through their jobs often find themselves facing those choices between medical care and food on the table. In addition, rural hospitals and first responders work hard to keep their doors open in our communities, and our communities struggle to recruit and keep good healthcare providers, making it harder for those residents to access the care they need. Rural areas need Medicaid expansion to make it more likely that people will have a hospital and healthcare providers in their community that they can trust. It also means that rural residents will face more local options for care, which reduces that need for those long drives to reach facilities and see providers and those specialists in bigger cities. Medicaid expansion will help South Dakotans. For that reason and many more, the South Dakota EMS Association is proud to support Amendment D. It is now my pleasure to introduce Charlie Clute and the South Dakota Firefighters Association.
Good morning. I'm Charlie Clute. I'm president of the South Dakota Firefighters Association and a firefighter and EMT in Viborg, South Dakota. And we know that having a strong healthcare system for South Dakotans is important. And many of the ambulance and emergency medical services across the state are volunteers that provide that initial care. The emergency services that will most directly benefit from the Medicaid expansion are emergency medical services. And we believe that it's important financial assistance that the Medicaid expansion will provide will help ensure a strong emergency medical services for those communities. And we believe that Medicaid expansion will be beneficial to our fellow emergency service agencies and continued care for those South Dakotans that need it.
So thank you, Amy. Thank you, Charlie. I appreciate that you're both here to join us today. At this time, I guess I would take a moment to pause and ask, are there any questions that anybody has for any of the three of us? And you can certainly either unmute and ask or type them in the chat room. We'll be monitoring that for you too. So I guess as we're taking a pause here, what I would like to do would be, first of all, again, to thank Amy and Charlie for the work they do in representing their agencies. And I would certainly want to recognize all of the state's first responders, people that work tirelessly to keep South Dakota's communities healthy and strong. I also want to let you know that, as we begin to conclude our time together today, as a reminder, there's a lot of conversations about Medicaid expansion happening in many communities across the state. Our friends at the American Cancer Society Cancer Action Network are hosting a series of film events. This film is a short-term documentary that showcases 3 stories of hardworking South Dakotans that really had to overcome some tremendous barriers to access care. So the first of those events will be tonight here in Sioux Falls. There'll be follow-up events in Rapid City and Aberdeen in the coming week. And if you'd like more information on those events and being able to attend them, we have information up in our chat right now with the link that will provide you access to that information. And again, I just want to bring us all back together and just close by really reminding everybody that ensuring that our neighbors get health care is the right thing to do. And as we look at Medicaid expansion, not only does it allow us to do the right thing, it allows us to do the fiscally responsible thing. The passage of Constitutional Amendment D will provide important financial protection to hardworking individuals with chronic conditions. It'll provide coverage for critical healthcare services and will help ensure that care that people need remains affordable and it remains in the rural communities and places where people are living. So supporting a healthier South Dakota and a healthier community can be done by voting yes, again, on Amendment D this November. So with that, if we don't have any other questions, again, I would thank you for taking the time to join us today, and we appreciate your sharing our message.